Welcome. I am Dr. Jason Schmidt from the Vance Thompson Vision location in Sioux Falls, South Dakota, and Alexandria, Minnesota. And welcome to the Dry Eye Dialogue, your one-stop shop for all things dry eye related. I've got two of my esteemed colleagues here, Dr. Nick Risperud out of Fargo and Dr. Lorraine Zimprick out of our Sioux Falls office. So welcome, guys. And yeah. In the final part, I just kind of want to talk about implementing strategies into a practice. So we talked about all the diagnostic tests and ways to assess this and new treatment modalities, but where do you start? It seems like a lot for people to like, I don't know where to start. So Nick, do you have a suggestion on how do you start bringing some of this to reality?
I think first, I wasn't always passionate about dry eye, to be honest with you guys. I found it frustrating to treat in school. And you got out in the real world, and I realized like how many patients are actually struggling with this. So I'm trying to, because bottom line, you won't be good at treating something if you don't enjoy treating it. So committing to it, committing to maybe acquiring another piece of technology or another diagnostic to help you. Just creating like a streamlined approach to customized treatments for each patient. Unfortunately, insurance comes into play sometimes of what you can bill for and what you can collect, whether insurance will cover a diagnostic test or not. But I rely on a lot of diagnostics to help me make the diagnosis instead of just what my eyes see in the slit lamp. For us, we're usually hammering it hard before our surgeries. So for me, I'd love for these patients to, get here already treated, already on a treatment plan. But if I'm going to start implementing, dry into my private practice or, start with the basics, I don't always stain patients with sodium fluorescein. If I'm going to do more, I'd start staining everybody and just getting better at finding these things. And I think, measuring osmolarity is really simple and fast. And then, something to image the lids and help us out. Because those aren't always, that's not always easy to catch. So I'd start, measuring osmolarities, checking for inflammation, and imaging the lids can just be really helpful.
Yeah, I would. I think that's great. Like the latter, I liked all of what you said. I would say if I was going to implement dry eye into my practice, it can be very like you can do it cheap, right? All you really need is sodium fluorescein and your fingers, because you can put sodium fluorescein in the eye and you can tell if there's any inflammation, any SPK. You can test tear breakup time, and you can also pull the lid down and express the glands. And between those three things, you're almost going to be able to determine what the root cause of the dry eye is. Of course, all the other diagnostic tests that we have are able to like quantify things and give us certain values and give us these values that if we do, LipiFlow or tear care, or whatever we may do, if we do an in-house modality, 3 months later, we can repeat the test and see that the quantity of that grew. And so it's nice to have those tests, but, implementing dry eye into your practice doesn't have to be that expensive. And one thing that I think is implementing this is to know that it does take some educating on your regular, well, if you're in a primary care practice, your regular patients, explaining to them, hey, if your eyes are, it's just a simple question or a speed questionnaire, something that we can say, hey, I saw you filled the sheet out and it looks like you have burning eyes, 3 days a week. Then this exam could transition to a medical exam, right? That can transition to a medical exam, or you can finish the vision exam and say, hey, come back and I'm going to put you through a dry eye eval. And figure out what the cause of this is, and that can go to your medical insurance. And so I think it can be very easy to implement dry eye, but it also, you can get lost in the weeds on what equipment to buy, when you're wanting to do that, but you don't necessarily need it.
Yeah, I agree. I think there's a study that I remember now that I think it was Cooper Vision did years ago, that an average patient in a private optometry office generates $30,000 over a lifetime. And that's by keeping them happy and seeing well and whatnot. And you don't want to lose those patients because they're struggling with not being able to see, their contact lenses aren't working, and those patients then jump and come into our office and want to have surgery. So keeping them in your office is important. So financially, that's a reason to try to, what can I do better to manage these patients? Second is, implementing dry eye can be financially lucrative as part of your practice. You can turn your vision insurance exam, like you said, maybe into a medical exam, and then having them come back again for a repeat visit for that. And if you're saving on remakes and contact lens chair time and those kind of things, that can also help improve the bottom line in your practice. So you don't need to have all these things, but the AOA recommends two things: do an objective test and do a subjective test. So the objective test is the questionnaire, and the subjective test is stain in your finger, push on their glance. And if you want to invest in measuring osmolarity and inflammation, those tests reimburse as well. And so you can do that. Some of these bigger in-house treatments are not covered by insurance, and that's a good thing. And we charge patients over $1,000 for some of these things, and they need it and it works. And so those are things that you can kind of build up to if you want to, but it can really end up helping the bottom line of your practice to grow. So, kind of to wrap it up, I thank you both for joining today. There's a lot of valuable insights here. This was a wrap up of today's Dry Eye Dialogue. I'd like to have our listeners tune in to understanding the nuances of dry eyes more by attending some of these lectures that were coming up. We've got 2 new lectures coming up here in the next, one in Sioux Falls, February 24th. We're having a big symposium in Sioux Falls to learn more about all things eye, and one in Alexandria on April 18th to learn about additional things related to the eye. And patients and or doctors can come into our offices anytime they want and spend half a day or a day with us and go over like a little mini fellowship where we can learn even more about dry eye disease and hands-on learning. So, until next time, I guess, stay curious and keep learning. The world of eye care is ever changing, and so are we. I want to thank Lorraine and Nick for engaging with us today. Make sure you visit our website and follow us on social media for additional resources and updates. Tune in next time for an awesome discussion on the Sharp Science Sessions, all things LASIK. Well, I'm your host, Jason. Take care and good night.
Thanks, Jason.